Unleash the power of knowledge and connect with the heartbeat of the African diaspora. Download our African Diaspora News Channel app now on Google Play and Apple App Store. Stay informed with authentic and diverse perspectives, breaking news, and cultural insights. Immerse yourself in a community that celebrates unity, resilience, and progress. Experience the vibrancy of the diaspora at your fingertips. Don't miss out. Empower your perspective today. Search African Diaspora News Channel and join the conversation.
Well, well, well. The Medical Council of Canada has just released new Black Health Learning Objectives. Take a look at what one of the doctors here in Canada has to say. Her name is Dr. Moron.
Good news! For the very first time in history, medical students will have to learn about Black health and the impacts of anti-Black racism on Black community health. The Medical Council of Canada just released Black Health Learning Objectives for the very first time, and this will feed into the exams eventually that medical students have to write before they get their license. So 3 quick things about this. Number 1, I'm really hoping that it helps patient care, particularly Black patient care and quality of care, since students will have to understand the impacts of anti-Black racism on our everyday lives, as well as what happens often to patients in care. Number 2, I'm very proud to have been part of this process, along with Dr. Omi Shere-Dryden and Dr. Barbara Hamilton-Hinch as part of the work of the Black Health Education Collaborative. And what fed into this was the input from various Black scholars and physicians and clinicians around the country who contributed to our Delphi method study. So thank you to all of you folks. And number 3, we're hoping for a positive reception, but at the end of the day, the point is this is just the beginning.
Well, this doctor is hoping for a positive reception to this new objective. Will it help? Will it change a thing? I wonder how many of them folks are going to now drop out of these courses, especially if they layer it into the exam and you being able to get your license as a result of this portion of what they have to learn. We probably are going to see a decline in the amount of them folks. We'll probably also see a lot of Karens and Kens coming out in the wilderness, people from the government of Canada that are going to do the most to try to get this to not be a part of the curriculum. What about race-based data? That's also an issue here in Canada. There is no race-based data. So there are always issues when we have to be diagnosed or tested for something that's going on within our community. We are also the highest numbers of things like high blood pressure, issues with diabetes, issues with obesity, all of the things that are higher always in our community. And due to lack of race-based data, they have issues trying to treat us. So what about that? Are we going to also make sure that we have this data so that this will help as well? Will patients be treated differently when they're being treated by them folks in the medical field? Will them folks treat nurses and doctors that are Black differently? We want to see whether all of this will change as a result of this. This just came into fruition, so I will definitely be keeping my good eye on this to see how this unfolds. And I will keep you all posted because I know it's coming. I am not ready to jump up and down about this, for sure not. Let me know what you all think about this. Don't forget to like, subscribe, also share this content. Also, download the African Diaspora News app. You want to grab it at the Google or Apple store, or head over to africandiasporanews.org and download it there. You'll have access to content you won't see anywhere else, so you want to get that app. Also subscribe to my YouTube channel, The Black Experience. Until next time, please be safe, everyone. Peace be.